name is Dr. Michael McGee. I'm the chair for the NMA's Council on Violence Prevention. I'd like to thank you for tuning in with us on this night, especially when we have NBA playoffs going on. Tonight, you will be seeing a quick rebroadcast of the Urban Violence in America Plus Solutions webinar that we did at our New Orleans conference back in August of 2023. I'd like to first thank NMA for allowing this to happen, as well as our illustrious president, Dr. Yolanda Lawson, and our executive team, as well as Howard Center of Excellence, sponsored by the Department of Health of DC. We have our illustrious panel here. Right now, I will not introduce each of them, but I will say their names. We have Congresswoman Robin Kelly from the state of Illinois. We have Noble past President Brenda Goss Andrews, all the way from Detroit. We have Dr. Abdullah Pratt, who's doing some amazing things on the south side of Chicago. And we have our wonderful Jada Watts, who is a fourth-year medical student who will now be a resident in emergency medicine at the University of Chicago. So right now, we're gonna pause and have you see our broadcast that will be introduced by our Speaker of the House, Dr. Roger Mitchell, who's also a Howard grad. So we'll tune in shortly after, and we'll take Q&A and have questions. So thank you for being here tonight.
Violence in America, Volume 2. This is a sequel of what we did last year in Atlanta. And you're gonna hear more about it. But I would first want to tell you just how this started. 9 years ago, close to 10 years ago, I was chief medical examiner of Washington, D.C., and I met the then executive director, Martin Hamlet. Was not an active member at the National Medical Association then, and he walked into my office in Washington, D.C. and said to me, "Hey, you need to come back to the NMA." And I said, "For what?" And he said, "For whatever you want to do." And I said, "Well, what are y'all doing surrounding violence as a public health issue?" He said, "Well, we're doing this and we're doing that, but if you have some ideas, let's do it." And I said, "Okay." So that year, we started the first presidential task force on violence prevention. And so every year subsequent, we had a task force for violence prevention. It was presidential. But if a president decided on their platform that violence was not something that they wanted to focus on, then it could go away as quickly as it came. And so this past year, with ratification of the House of Delegates, and all of the work that we've done to set the framework surrounding conversations on violence prevention, the House of Delegates ratified that violence prevention would be a standing council of the House of Delegates. And so that's a place for you to clap right there. So this organization now has a standing in the bylaws council on violence prevention. That there's no season that it can go out of season. It needs a bylaws ratification in order to remove it. And so the excitement about that is that now that we've built this runway, we can take off. And so the future of violence prevention work in the National Medical Association will be about action, will be about policy, and it will be about programming, as much as it's about elucidating our ideas and research in the academics of violence prevention. So during this time, I had the great opportunity to meet probably next to me, but better than me, one of the most prolific advocates for violence prevention in this country, bar none. And so he's been working alongside me and leading me in leading this organization as the inaugural chair of the Council of Violence Prevention, Dr. Michael McGee. That's another place for you to clap. And so, Yes, he's an emergency medicine doc. Yes, he's member of the 100 Black Men. Yes, he's active in his society of emergency medicine physicians. But most of all, he has a heart for people. He has a heart for people that transcends his medical degree. Because I believe that if he didn't have a medical degree at all, he would be serving towards the freedom of our people. I think of him as a brother. And so I want you to welcome him because he gives of his time, he gives of his labor, of his time and of his talents and of his treasure to this work. And he's curated for you a phenomenal panel that will help us understand and then actualize the work of violence prevention for our organization and for our community. So without further ado, Dr. Michael McGee.
Greetings. Thank you, guys.
A 19-year-old student was shot.
Just last night, 4 people were shot.
40 people were shot.
Overnight shooting.
Mass shooting.
Chicago just experienced its most violent Memorial Day weekend on record.
I can't let him take my soul.
How many of you guys have a family member that's been shot or killed by guns? Raise your hand. How many of you guys have close friends that have been shot or killed by guns? A close friend. Stand up if you have a close friend that's been shot or killed. Come on, everybody see it. Look around. Look around. That's an epidemic.
No. I can't let him take my soul. No.
Children are under fire all across the country. How do I know that? 4th of July, the hottest time of the year. This past summer was the hottest ever. Global warming, El Nino. And everybody knows that during times of heat, shootings occur. In this case, 17 mass shootings were recorded during July 4th. Look at the areas where it occurred. Very sad. Just in Baltimore, 30 people shot, 2 dead. At a block party, at a fireworks show in Philadelphia, 5 people killed. Out of that 5, 2 were teenagers. What did I say about situations that happened throughout that time? Out of all these shootings, at least 2 or 3 kids under the age 19 got shot or killed. That's a problem, a public health problem. Now, this is January. Look at the mass shootings. The heat doesn't make a difference. It's the senselessness of it all that does not make sense. And even physicians, healthcare workers are now under fire. We've had a 67% increase in the medical field, physicians, nurses being affected by violence and shootings. It's a problem. My objective is for you to recognize the impact of firearms in Black communities. I want to show you the effects of COVID on what it did to these communities. I also want to show you strategies and innovative policies to reduce violence. But I also want to show you and the faith-based communities what you can do. We need your help, more importantly. Just going back historically, looking at other countries, Black people have been getting shot well more than any other race, 19.4. per 100,000. Looking at kids, traditionally, United States have been known for kids dying at a huge clip when you compare us to other countries. Should not be happening. We all want to equate mental health with the reason why people shoot. Well, that's not true. According to the American Journal of Psychiatry, only 4 to 6% of people who shoot other people have mental illness. Most people with mental illness, they lack mental wellness. They don't know how to cope. They don't know how to manage their anger. Because, in fact, the people who are truly having mental health illness kill themselves. They shoot themselves. They don't want to shoot you. That's why this statistics shows you why people commit suicide far more than homicide. You also see a huge dip in terms of the number of people being shot from 2019 to 2020. It increased dramatically. Health disparities, they are there. Black lives do shatter, happening all around the country. If you look at the poorest neighborhoods, they have the most people dying from senseless gun violence, where it be interpersonal, domestic violence, group violence, what have you. It's happening. And it's happening in these poor communities. Why not put the resources there? Why not give them what they need to get out of that oppression and that continuous cycle? And in those same areas are the churches and the faith-based community. We all got to come together and do more, and we can. Looking at historically, this is homicide data. It shows you that black men die well more than white men. Out of this data here, 87% were male, and most of these people were shot by somebody they knew. And the saddest part of all, people think that a lot of these fights and situations that occur where someone's getting shot is from gang involvement. That's number two. I've looked at this data for the past 6 years, and it's always the number one reason as to why people get shot or injured from guns is altercations. People don't know how to control their anger. They're angry, they're mad, and then they have access to a gun. And this is where we are. Looking at this, blacks make up 13% of the population. Black men make up 7% of that population, but account for over 52% of all of these homicides. They are the victims. 7% black males make up that 52% of homicides you see all over the country. Firearms are the leading cause of death for teenagers and kids and babies. From age 10 to 24, homicide is the number one killer for young black men and the number two killer for Hispanic men. Domestic violence, that's the number one health issue facing black women. The fear of a black woman being killed by a black man is 2.5 more likely to happen than a white woman by a white man. We're not loving our black women, and we can do better. They're killed by somebody they know, and usually with a handgun. Why is this happening? It's not just on the individual. It's not just on that parent who's in the hood. It can be all kinds of reasons. It could be substance abuse. It could be a history of violence in the family. It can be poor parenting skill. It could be low socioeconomic status and not having jobs. But then the community, what community are they living in? Is there poverty? Is there high unemployment? Do you have to sell drugs to eat? These are factors that we don't always look at. And then what's the societal situation? What's the weak economic safety net? What is your community and your city doing to get you out of this cycle? It's happening. It could do better. The social determinants of health, we hear about this all the time, being adversely affected, from healthcare to neighborhoods to economic stability to education. All these greatly affect what you will become in your neighborhood. But when COVID hit, it unleashed a beast in 2019 to 2020. Not only were we affected by COVID and the social determinants of health, but you could not bury your loved one. Imagine an 18-year-old who was hanging on by his grandmother who raised him like they did me, and now grandmother died and I can't bury my grandmother. And now I'm out here in this world doing whatever I want. What about seeing the racial injustices and inequality and the over and under policing, where police did not even want to go to the neighborhood where there was crime. And the people in that neighborhood did not want the police there. So things got worse. What about the despair, the social unrest, the homelessness, the people who couldn't eat, the lack of job, and yes, the lack of mental health care? And then access to care. In the first 3 months of COVID, over 2.1 million guns were bought. And it's even gotten worse. And so moving forward, this is a great study that just recently happened with Johns Hopkins. They looked at the data in 2020. They saw that over 45,000 people died, the highest ever. There was an increase by 35% of people dying from 2019 to 2020. They saw that black men, 20 times more likely to die as a victim. They saw that states with stronger gun laws had lower rates of gun violence and was less likely to die. This is a known fact. Look here. All these states, Louisiana, Alaska, Mississippi, are all Southern. Most of them are Republican, and most of them have a high number of people who are dying and kids dying from senseless gun violence. New England Journal of Medicine, and this is the icing on the cake, is why you're seeing funding right now addressing this problem. They saw that now kids under 19, not just black, not just Hispanic, all kids are now dying senselessly from guns, not just from homicide, but also suicide and unintentional injuries. It's a problem now. It superseded everything from motor vehicle crashes to congenital abnormalities to poisoning and overdoses. Firearm-related injuries is the number one reason why all kids are dying. And it's gotten worse in 2022, and it's gotten worse in 2023. This is important. Looking here, from 2019 to 2020, you see we went up 35%. Well, from 2019 to 2021, we went up 40%. If you go down to mass shootings, 414 mass shootings in 2019, in 2020, 610, and steadily going up. If you look at suicide, hanging around at 23,000 and now 26,000 and now 27,000. I want to go back, looking at kids. They looked at 0 to 11 and then looked at 12 to 17. And as you can see, in 2019, 4,000 kids total got killed or injured from guns. Well, in 2021 to 2023, it's now 6,000. So it's gone up 45%. And the travesty of this is this. They only looking at 17. They're not looking at the 18 and 19-year-olds. So those numbers are even much higher. And so we got to end the gun violence. Our kids are dying. And oh yes, there is some parental responsibility. There's 4.6 million guns in the house that are unlocked and loaded. And the kids know where they are. And so, moving forward, this is showing you the same thing. These are just kids who have gotten killed from senseless gun violence in their homes when they've gotten their parents' guns. These are all preventable deaths. We got to do better. We got to lock our guns up. We got to teach our kids to not shoot, to not play with the gun, to not look at a gun, to not point a gun, and then to tell somebody. We got to protect our kids. So we've partnered with NOBLE, the National Organization of Black Law Enforcement, who's giving education on gun safety and locking your guns up. The churches need to be preaching this, need to be teaching our kids at an early age to not play with guns. Let's have some gun educational courses in our churches because we are the closest to the families. Let's do more community service work. Let's go out and do blood drives because guess what? When COVID hit, the blood draws stopped. People stopped donating blood, and so we had a critical crisis. You may go to a city and be in a bad car accident and go end up in Gary, Indiana, and we may not have the blood to save your life. So we got to do more blood drives. We're at a 10-year low. The public health problem shows we got to define the problem. We got to look at the risk factors and develop and test strategies. We have to ensure widespread adoption of these effective programs. Looking at what we're doing, and it's our last slide, this is what our council is doing in terms of being at the table with Congress, in terms of working to promote safe stun gun swords, to partner with American Red Cross, to create a meeting of the minds coalition for all of us to come together to come up with ideas to save our youth, to promote community policing, to educate medical providers on how to stop the bleed and do CPR. Most importantly, let's engage our youth. In the churches, you do have a fiduciary responsibility. Let's educate the community about the stats I mentioned, about strategies they can do to prevent violence, to also show the resources. Where can they go to get the funding they need? Let's go after these grants that are out there. Let's encourage our community to vote. Let's engage kids on all levels, not just the kids coming to your church, but the kids who are high risk, who are in the communities, who are owning guns. Let's educate them. Let's give them more activities to have them to be involved. Let's address the social determinants of health. Do whatever you can to educate, to provide food, to provide jobs, to decrease the poverty. And oh yes, we need to focus on mental health and the post-traumatic stress disorder, and then help disrupt the cycle of violence. And last, we love for you to partner with our Council on Violence Prevention. And so now you're seeing that groups of churches and communities can come together for the betterment of our youth. And so with that being said and done, it always seems impossible until it's done, especially with God on our side. Thank you.
Next up, all the way from Shy, who's been doing some wonderful things. Someone just said that someone who's nice and well-liked is better than someone who's powerful and important. This person right here is so well-liked that she's out at every event that she can. The community embraces her. She's done some wonderful things for Congress. She was one of the first U.S. representatives to write the Red Book on gun violence. She did this before a time when no one really was even paying attention to gun violence. She has a PhD in healthcare, and she's a good friend. So I want to go ahead and introduce Congresswoman Robin Kelly.
Thank you so much, and I want to thank the NMA for taking this up as a cause, a goal, a value, because it is just so very important. I've been in Congress 10 years. I represent the 2nd Congressional District of Illinois, so I'm urban, suburban, and rural. And I ran on gun violence prevention. I ran in a special election, and when I ran, that's when Newtown happened, and then a little bit later, that's when Idea Pendleton happened, and then it just kept on happening and happening and happening. And what makes it so sad that even though I ran 10 years ago on this, we are still fighting the fight today. Last Congress, and looking at my colleague Danny Davis, we finally passed the Bipartisan Safer Communities Act. 30 years since we were able to pass something around gun violence prevention. That is absolutely ridiculous. And as you know, so many people have died. We talk about the people that have died, but so many people have been maimed. So many people are dealing with trauma from the gun violence situation. And I actually do have legislation that I just filed again for gun violence to be looked at as a public health crisis, so that we collect data. Data informs policy, and it also informs where the resources go. But we passed the big bill, as I said, last Congress, but even though I say bipartisan, but we still had to water it down to get Republican support. But it deals with straw purchasing, gun trafficking, red flag laws. We were trying to change the ability to buy an assault ban weapon. You know, you can buy that at 18. You can't buy a handgun at 18, but you can buy that. And we were trying to change that to 21, but we just could not get that passed. So now there's extra vetting if a young person between 18 and 21 wants to buy a gun. But I have a lot of different pieces of legislation. A lot deal with investing in our communities, because if we don't invest in our neighborhoods and our young people, this is going to continue to happen. And there was an article, 2 articles that just came out about the Chicagoland, even though Black and brown unemployment is at an all-time low for Black and brown folks, not in Chicago. Chicago, the Black unemployment for 16 to 24 is 10%, 3 times higher than white unemployment for the same age, and much higher than what it is nationally. And I always say nothing stops a bullet like an opportunity, whether that's a job, a mentor, a hobby, better education, access to health care, as my colleague just talked about, access to therapy. We have got to do better, else we're going to be on this rotation constantly. It's never going to end. And all of you, we need your voices. We've done press conferences with ER docs from the Maryland area to talk about, what they've seen, but everybody can play a role. There's room for everybody. So I'll just stop there. Thank you guys again and wait for the questions.
Please clap it up for Congressman Robin Kelly. The next person on the dais has over 10 years of experience in trauma care, acute care, critical care. He's actually a proud graduate of Howard Medical School as well, so clap it up for that. Matter of fact, while we're on Howard, we have two other people up here who are from Howard as well. Brenda Gross Andrews, as well as Jada, who is a fourth-year medical student, so you hear from them as well. So Howard's representing, definitely needed. So Dr. Wilson also did his residency at Emory in Grady, which is where I spent some time as well. So he's well known in Atlanta as well. And we were blessed to have this guy come to University of Chicago because, for years, University of Chicago, which is right on the south side, had no designated trauma center. So he was one of the first people to come. He's now the practicing trauma medical director as well. So he's seeing it. He's in the thick of things. And when we first started doing things with my little project program, I reached out to Ken, and he stopped what he was doing, and he was there to talk to the youth that you may have seen on that video. Not those youth, but we've been doing this for several years now. He's been there. He's given his voice and testament to them. He's shown them that, hey, you can be a black male doctor as well and a trauma surgeon. So please clap it up for Dr. Ken Wilson.
And you mentioned publication. So there's a publication that also came out recently that said that you are more likely to die if you're in the cities of Chicago and Philadelphia if you are in Afghanistan. After someone who has done 4 tours of Afghanistan, unfortunately, I have to believe that there's some validity to that argument. The last time I saw you at one of these events, and of course it's about violence prevention, we were at a church in Inglewood, and I'm from West Baltimore originally, which by that sector of Baltimore is very similar to the south side of Chicago. And I remember being in those churches, doing bake sales and, dressing up like Jesus or Joseph, but never back then did I think that I'd be at a church teaching them how to put on a tourniquet and how to stop a bleeding for a colleague. So since I've come to Chicago, we've developed a trauma system that exposed a few things. One of the things that was already pre-existing was the Children's Hospital at the University of Chicago on the south side. And when I got there in 2016 or 17, somewhere in that time frame, since that time, the number of children preventing has gone up 3 times the amount. The national average for penetrating trauma in the United States in general is 12%. For children, it's somewhere down in single digits, but on the south side of Chicago, it's 19%. We divide the admissions to the Children's Hospital, or the presentation to the Children's Hospital to the Adult Hospital by 15 and 364 days. So if you're 15 and less, 16 or 16 and older, you go to the adult side. If you're 15, you go to the children's side. But the problem is when we looked at the data, that there's a shooting at every age range. That goes from 1 year up until 16, which then qualifies you as an adult. So for children, there's not an age that is not represented. And we looked at the percentage of penetrating trauma. It is not children running with scissors. It's not falling on a piece of glass. More than 45% of those under the age of 14 have been shot. For those who have been shot in that age range, more than half of them happen after dark. So of course, I think back when I was living in my mother's house, there was being in the door with the alarm on, and that was the end of that. So to the point of prevention, trying to find things and places for children to go, places to be, and to have a future, that is where it should lie. But as I mentioned, what's happened unfortunately for me, I am not preventing trauma, I'm preventing exsanguination. So, these programs, what Mike is doing is very important. And again, I didn't grow up like this, so I want to give them the neighborhood that I grew up with, where little ladies could walk around and not be injured, and I played safely as a child. So thank you for having me, and I look forward to answering any of your questions.
Thank you. So we were at St. Sabina's Church with Father Flavor, who does a lot for the community, and we went there, and that was one of our locations doing National Youth Violence Prevention. We went from different schools, brought people like this, Dr. Pratt, and actually tried to inspire the youth to see what they can be. But at the same time, we have compelled to teach them Stop the Bleed and other things, and show them videos of the statistics so that they can get an idea that the next time another young black man shoots another black man, that the #1 killer for black men, age 10, used to be 24, but now 34, is homicide. And it's the #2 killer for Hispanic men as well. So they need to know these things so they can recognize, hey, let's take a pause for a minute and let's not do what we're doing. The next person up is in this space. He's been in this space for a while. He attended Valparaiso University in Indiana, where I'm from, and has been a University of Chicago baby, from medical school to now residency to attending. He's been doing some fantastic stuff. He's been on CNN. He's been interviewed by a bunch of people. He has been going out into the community doing those things that Dr. Wilson just mentioned, even before I started doing it. He was going out to marginalized communities and teaching youth how to stop the bleed, plus how to do CPR, plus how to recognize a stroke, plus how to recognize a heart attack. And also, he has a program that he'll be discussing shortly, and he's been doing some amazing things. He's a proud member of the Nation of Islam. He does a lot with that community. We want to bring them to the table for our partnership. We want to partner with any and everyone who's willing to do something for our youth. So without further ado, Dr. Abdullah Pratt.
Knowing how emergencies occur and the solutions to them really helped introduce me to the aspect of being an emergency physician.
I talk to children, I tell them my experience. I also help Dr. Pratt with his Stop the Bleed initiative, his emergency preparedness initiative.
We created a program called Trap Violence within our program. And Trap Violence stands for Trauma Recovery and Prevention of Violence. And that was created because the youth wanted to talk about their father that was killed, or their brother that suffered a bad car accident and lost a lot of blood, or an aunt who had a bad stroke, and what they should have done. Did they do the right thing, and how did they cope?
It gives children who grew up in communities like myself or grew up in situations like I did, it gives them an opportunity to fight healthcare disparities and be the impact on their community.
I was drawn to the program because it not only offered a course in emergency preparedness, but it also showed you the social impacts that drive emergencies in the Chicago community.
Those of us who work with the MedKeep initiative are literally creating the programs to show value, that we value these lives, because they're our little brothers, they're us.
Oh, most certainly life-saving skills here that we can all benefit from.
My biggest goal in creating a medical careers exposure and emergency preparedness program was because it was really demanded of us. And one thing I have to correct Colonel Wilson on is that, he is doing those same kind of things that Mike is doing, because since we even announced we were starting a trauma center, Dr. Wilson, Dr. Rogers have been faculty mentors and guides of my own, even allowing us to create a non-for-profit called the MedKeep Initiative, because we were so limited in these works. And it's in that energy that I wanted to talk today, which is how do we respond? So for us, we were responding to the biggest needs that our communities had. Our communities were, of course, leading in violence, leading in out-of-hospital cardiac arrest, not just leading amongst race, and leading the country in the rate of all of these emergencies. And our youth, no matter when we go in the community, we go to talk about healthy eating, healthy nutrition, and they say, yeah, but you're an ER doc. My brother was shot last week. Oh yeah, you told me about heart failure, but I had to do CPR. Did I do it the right way when my auntie went into cardiac arrest? And furthermore, what we found is that when we started teaching those skills, when myself, Dr. Wilson, others would go out in the communities and do these workshops that were being demanded of us, what we ended up finding is that those same students had interest in health careers, where teaching them how to deal with a gunshot wound gave them this empowerment wave, this inertia that they said, you know, if I could do that, well, maybe I could be one of those EMT people in the ambulance, or maybe I can be a nurse. My aunt's a nurse. What do I have to do to become a nurse? Because I really don't want to see people suffer. And that same suffering, they would hear my story. They would hear so many others who we would bring stories about how I lost my older brother to gun violence. I've lost over 14 or 15 of my closest friends, 7 or 8 of my teammates that I played, high school football and grammar school football with were all lost. And some of them now, by way of the fact that I practice in my own community, I'm the one pronouncing them dead now. So I'm the one telling people who I looked up to, like aunts, uncles, that your son, who you came to this hospital, and the first face you saw was mine, and you lit up, and you forgot why you came to the hospital. Oh, hey, I saw your mother, the other. Yes, such and such didn't make it. That's the reality that we bring into our programs. So our programs didn't start off with funding. We didn't write a grant for them or anything like that. Literally one day, I can remember like it was yesterday, Dr. Wilson said, hey, D, I got asked to do this series of workshops. I know this is something that you do well. You like to do it. You're a first-year resident. So I was just an intern at the time. You're a first-year resident, put it together, we'll all show up. And so from that moment, we started assembling skills. Okay, where they like trauma, we'll have some surgical residents do trauma demonstrations on chest tubes and crikes. And okay, they like CPR, we'll have emergency medicine residents and medical students do that. And it turned out so well that it became the foundation of what we call now the Medical Careers Exposure, which is one half, and Emergency Preparedness Program, which does those things. Every student that comes in front of us learns emergency preparedness. We've trained over 7,500 youth on the south side, east side of Chicago, west side of Chicago, in Stop the Bleed, CPR, and stroke recognition. What we found of that is that we also do medical careers exposure. So we've had over thousands of those same students get panels from physicians, nurses, EMTs, dentists that look just like them. And we encourage them to pursue early careers in medicine, because if you know how to save a life and you're invested in stopping the killing of lives, then you're less likely to take a life and you're occupied to not have your life taken. So that's one of our biggest theories. But guess what? We found out another thing. Just like Dr. McGee said, the number one pressing factor for these youth are violence and of course socioeconomics. And the violence that they had was so bad that many of them couldn't even get through one of these training sessions. So every training session, especially when we be locked to a certain amount of Chicago public school timing, would be able to say, hey, yeah, we're learning how to deal with a gunshot wound, but I was late a lot last year. I had to flunk a year of school because the site right in front of my school in Inglewood is where my cousin and my brother were both killed last year. And I just don't like walking past it. So I walk all the way to the back and I have to knock on the door. And because of that, I'm late and I don't check in, and they made me truant, and my parents didn't show up to the teacher conferences. So they just held me back a year. These were the kind of stories that they would have. It was just so much blood, Dr. Pratt. Then the next question they would have is, Dr. Wilson, Dr. Pratt, how do you cope with all this stuff? You all are there every Friday, Saturday night. I see it on the news, it's bad. And we'd be thinking, okay, wow, that's a really good question for a youth to have. And so we answer the question, but we found out that that was just a proxy for them to ask the question, if you're struggling to cope, how am I supposed to cope? And that forced us to create the Trauma Recovery and Prevention of Violence program, partially because many of the violence, the hospital-based violence interventional programs are purely that, they're hospital-based. And that was how ours was structured, and it was full of capacity, as you can imagine. And so we had to have a wing that would do pre-injury work. And that's where we are now with the Trap Violence program. These programs are in many of the schools that we work with. We've worked all the way up to Milwaukee, Northwest Indiana. And the biggest thing that I would say is that these programs and the problems that we have forced us all to work together. So if you see the same faces doing that, that's because there's no competition in this space. There's work to go around. And many times we all have to join forces just to get there because funding is low. And unfortunately, even though our faces are being used as the pain and suffering for violence, many of the resources that are cut by our politicians or our entities and public factors never reach down to the very youth who are walking these streets every day.
The next person is another Howard graduate. She did an undergraduate there and also went to Michigan State where she did criminal justice and then went and got her PhD from there as well. And she's also a retired police officer from Detroit who rose to become the president of NOBLE, which is the National Organization of Black Law Enforcement. I was very proud to have met her. Clap it up for that, please. Definitely. So I was very proud to have met her last year. We were both at the Congressional Black Caucus. My first time ever there. It was a wide awakening. It was some wonderful talks, and she was at a meeting that we had for 100 Black men, and we initially connected, and then she started telling me about her program that she initiated with NOBLE, which was to create a program that talks about gun-safe storage, and that it starts at home with education of your own youth and you doing the proper things for your firearms. And that's where a lot of the problems lie in, that there are a bunch of guns out there, and she's gonna tell you there are 4.6 million guns that are locked, that are loaded and not locked. So that's why we're having a lot of the situations we're having. So she has an outstanding program that she's gonna discuss, and we love for her to come on up.
Once again, I'm Brenda Goss Andrews, retired Detroit Police Deputy Chief. I worked in Detroit. I was a street officer. I was a beat officer. And I saw some unimaginable things, as many of you in the profession, medical profession, may have seen. I spent a career there for about 30 years, from the police officer all the way to one of the chiefs of the department. As Dr. McGee says, I am the immediate past president of NOBLE. But more importantly for me now is the founder of It Starts at Home initiative. I'm gonna talk to you a little bit about that program, why it's important, and how I got there. First of all, law enforcement and first responders are the first ones on the scene of anything that goes on, and then they come to many of you in the hospitals. So all of us have seen the devastation of gun violence and injuries, but nothing in my 30-year career ever prepared me for seeing the death or the injury of children, of babies. And I have seen enough of that, and I am sure all of you have too. That is why this crusade to save our children from death and serious harm, to save our adolescents from suicide. You know, suicide is going up, and preventing the next mass shooter from having the opportunity to get a gun. And these guns are coming from homes like mine, homes like yours. But these can be prevented. I know we wait for legislation. We appreciate what our legislators do, but they have opposition there too, and it makes it difficult. But there are things out here that we can do. Dr. McGee and I talked, and I was impressed with his Stop the Bleed program. Our It Starts at Home program, I looked at that as kind of a companion to what he's doing, to outreach to these young people and to our parents. So we have rolled out the It Starts at Home program, which is a safe gun storage initiative. And we've done programs in Baltimore, Detroit, Columbus, Ohio. And what we do is give them this talk, but we also pass out free gun locks. We don't ask their names. We don't want to take their guns, because a lot of times in some of these communities, they're a little bit leery. Walmart was an early sponsor and gave us free gun locks, and we're also looking for any new sponsors. But seriously, we can prevent our children and young people from death and serious injury by unsecured guns. Every town, there's a mother there that gave her story. And she was going out of town, and her child was going over to a trusted friend, family member. She went and enjoyed herself, and before she could finish her vacation, they were calling her to come back home. And she told that story, that she came back home, she dropped her child off and came back, and her child was dead. This was a relative, this was a friend, because they left the gun unsecured. So this is just so serious, but we don't realize, we're not talking about it. When your children or grandchildren are going to visit someone, do you ask? Do you have a gun at home? Do you ask them, is your gun secured? Because it only takes a second. 2- and 3-year-olds are getting guns, and they're pulling the trigger. They don't have the old Smith & Wesson's 6-shot where you had to have all kinds of pressure to pull that trigger. These automatics, a 2- and 3-year-old can pull it, and that lets me know they didn't even have the safety on in the house. So we can prevent this by working together, and I'm calling on law enforcement, schools and universities, churches, nonprofits, fraternities, sororities, businesses, and all of you out there in the medical profession. We can all become a part of this movement. It starts at home to stop our children from dying. We can prevent this type of gun violence. So,
the next person coming up is a 4th-year medical student at, guess where? Howard. She's representing. She's from West Virginia, and she did undergrad at Howard, and now she's in medical school there, and she wants to go into emergency medicine, so clap it up for that as well. So she is, I'm gonna let her tell you her story. I really wanted to have someone up here who can give their personal testimony as to why we do the things that we do, and there's no one any better than Jada to come up and tell you those things. So Jada, and her family is here. Please clap it up for Jada's family. Please stand up. Jada's family, please stand up. You're here. Awesome, clap it up for them. Came all the way from West Virginia. Awesome.
Hi, everyone. Hi. It is such an honor to be here. Thank you to Dr. McGee and Dr. Mitchell for inviting me today. I just really wanted to share my story with you all so you could come to action to see the reality of what me and my family have had to go through. I think sometimes when we think about gun violence and gun violence prevention, we think about it as a peripheral issue. You don't think that your brother, your son, your nephew, your daughter are going to be affected by that. And if you do not know somebody that has been shot, then you are privileged. So I would like to share my own personal story with you. Initially, I was very similar to you if you have not known somebody that's been shot. So before I lost my brother, I always would see these things on the news and I was like, wow, that is so sad. And I would go on about my day. I would carry on, go shopping, go whatever. But until this happened to me, that's when I started to become an advocate. So on May 2nd of 2021, my 18-year-old brother was shot and killed by an AR-15 rifle. My brother was a 4.0 student. He was an all-star basketball player, had just led his team to the championship about 2 days prior to that. And he was at what he called his friend's house, and we still don't know the full story behind what exactly happened. But unfortunately, we lost Dwayne that day. Now, as physicians, I think that we see the deaths, we call the times of death, but something that we're missing out on is what happens after. You tell the family, and it's just a blip in time. And sometimes, we have to do that as physicians to keep going, but the reality of it is that somebody just lost their son, and it is a tremendous loss. Our communities are suffering, and it's happening way too much. I live in DC, and we're in the double digits for juveniles being shot and killed. These are people that they're not going to their college graduations. They don't get a chance to go on vacation. They don't get a chance to be married. So I'm gonna be that voice for them today. So what you don't see is the organ procurement people calling 2 hours after you just lost your son. What you don't see is somebody picking out a casket instead of picking out somebody's high school graduation photos, their prom pictures. So as you guys navigate being a physician, I just want you to keep that in mind, that somebody just lost their loved one. Somebody just lost their best friend. So it's really important for us to start coming to action, because it doesn't matter. It really doesn't matter. I think we think that somebody has to be doing something bad. Like our panelists just said, there are babies getting killed, there are children getting killed. And it's really important that we are in these positions, that we start going out in our communities, yes, our communities, and start addressing this need, because there is a huge need for it. I'm tired of seeing teenagers telling me that they've had 3, 4, 5 friends shot. And as physicians, we can be that first line of helping people out and getting people through these difficult situations. So I'm really honored to be here with you all today and really excited to participate in this discussion so that we can become champions for our own community. Thank you.
Hello, we're back. I want to thank you guys for that wonderful, awesome town hall. It was truly thought-provoking, emotional, and truly to get people inspired to do the things that they need to do. We showed some very awesome numbers. I know we don't have a lot of time. I know people still anxious to get to the games, even though my Chicago Bulls are not in the playoffs. So we're gonna go ahead and go with a few questions, okay? We're gonna go ahead and start with a question for Brenda Goss Andrews. This is coming from one of our NMA execs, Roger Mitchell, Speaker of the House. He wants to know, what do you feel should be the next steps for NMA medical professions on the issue of gun storage? What should we be doing? You're on mute. We'll take you off mute.
Okay.
There you go.
Oh, okay. Thank you. Just awesome. Well, a couple of things, and I have a questions. So I'm kind of pull them all together in one response. Well, first of all, thank you, Dr. McGee and NMA, for the work that you're doing out here. But public awareness on forums like this is key to educating the community on safe gun storage, on reducing gun violence. But a couple of things, I just want to give a couple of other statistics. We talked about the 4.6 million guns in the homes, but approximately 350 children under the age of 18 are killed or harmed every year in senseless incidents dealing with unsafe gun storage. So let's keep that in mind. These are 350 young people that are being killed every year. 76% of school shooters get their guns from at home. Remember Sandy Hook. Remember Oxford High School, which is right here in Michigan, not too far from me, and how that outcome is. So some of the things that I would look for the medical profession to do is continue your outreach. We need all the medical professionals, healthcare professionals, children's hospitals and facilities. The National Black Nurses, I happen to look them up, and they have a conference coming in July, I think in California. So partnering with all those organizations, attending their conferences, trying to get on their agenda to speak would certainly be a way to continue spreading this word through the medical profession. I would also contact universities and schools, HBCUs. We have Jada here as a great representative, but these young doctors need to understand, like Jada understands, what their role is as doctors. It's not just patch and go, but to provide, counseling and try to do things that will prevent our young people from being killed. So getting the message out, Dr. McGee, does take time and patience. It's not a quick fix. We just have to continue working at it. And the key is to continue spreading this, writing journals, writing articles, and not only in your medical journals, but reach out, law enforcement. We have all kinds of publications, writing things from the medical perspective and putting them in, your journals and our journals. So lastly, I'm gonna call on your pharmaceuticals and your business stakeholders. They need to step up, and maybe they are, but they can provide needed resources and sponsorships, putting billboards up in our Black and Brown communities, buying gun locks like Noble had a sponsor to do, all of them. So I would suggest maybe bringing all these people to a round table, to a discussion, and seeing how they all can pitch in. So it starts at home and it starts right now, but we all must come together. This is a public health crisis. Thank you so much for having me here today.
Excellent answer. Thank you so much. As you know, we are preparing to have a Meeting of the Minds Coalition for Saving Our Youth. So we'll be getting back with you, and we'll try to get all those different stakeholders to be involved with this. And I agree. Not only are physicians credible messengers to their patients and community, but also the faith-based organizations as well. So we should be having these lessons taught in churches, as I mentioned in that video. That's the easiest way to get that message across, by somebody who they trust. So we can really put that as some of our solutions. And parents as well should be having their own individual conversations with their kids. And it's like you said, when you go to someone else's house, let them know what to look for and what not to do. So thank you for all of that.
Thank you. I look forward to working with you.
Thank you. We do have a question from Tony Williams for our Congresswoman Robin Kelly. We know a lot of amazing work has been done with President Biden already, just in terms of urban strawberry purchases and trafficking, providing more resources to the police. And most importantly, we're seeing so much funds and grants going towards these violence prevention programs, as well as jobs for the youth and reentry programs for ex-criminals. Since these policies were passed, Congresswoman Kelly, has there been any progress in Congress on gun legislation? And if so, then what?
Thank you, and thank you for having me, Dr. McGee and NMA. Unfortunately, because of the makeup of the House of Representatives, Democrats are in the minority, and we're the ones that tend to pass these pieces of legislation. So there has not been a lot done in that category this Congress, but actually there hasn't been a lot done in this Congress, period. So unfortunately, there's a lot of pieces of legislation, but they have not been called to the floor. But that hasn't stopped us. In July, I introduced a Recognizing Gun Violence as a Public Health Emergency Act, which would give HHS and our leading health professionals new funding to study our nation's gun violence epidemic. I produced the 2024 Kelly Report, and I had a 2014 Kelly Report, the first congressional analysis of gun violence prevention. So now I did a 10-year recap of what has gone on and still what we need to do. And, you know, we had legislators, we had professionals that work in this every day. You know that President Biden opened the Office of Gun Violence Prevention. So every day someone is focused, you know, on this issue. But again, there are bills, but it's just really hard to get them called. Recently, President Biden passed or had executive order that deals with firearm licensees. So he's made that more stringent because, you know, some people, they never really registered or were licensed because they claim, oh, I just did it, you know, on the side or, you know, whatever the issue was. So now more people have to do it because part of the issue is the access to guns that people have.
And so that's so very important because here in Indiana, we were the 25th state to become a permitless state to get a gun at age 18. And then Florida just joined. And since then, we have way more kids who have guns and who are on probation for having guns, and also going into the juvenile system because of having access to guns. And so it's resulted in parents, mothers who wouldn't otherwise have guns getting guns because they're afraid of the unkept young man with a gun. So it's a reciprocal.
I know it's such a vicious cycle, and really, you know, Chicago has some of the toughest gun laws, but if no one else around us does, and since I've been in Congress, Wisconsin and Indiana have made it easier to get a gun, and then we're surrounded by Missouri and Kentucky, you know, so over 60% of our crime guns come from other places.
Andrea Jones had another question for you, Congressman Kelly. She asked, what are some programs Congress should fund to address the root causes of gun violence?
Definitely. Well, the Bipartisan Safer Communities Act, that's what it is doing. And it's really trying to get the money to the communities that are on the ground, or to the agencies and programs that are on the ground doing the work. But the thing is, people have to apply. That's something that we run into. In my congressional district, we try to get out as soon as grants are available, to organizations that we know work on this issue, because there's a tendency for the bigger organizations that have the grant writers, professionals, and a lot of people to continue getting the money. But we're trying to get to the people, as I say, that are really on the ground. One of my community member money that I gave to a church that's doing some, on the ground community work with gun violence. But any programs that are working with kids, mentors, even programs showing kids what opportunities are out there. I work with an organization called Polished Pebbles, and they work with girls, but just showing girls, you can do this, you can be the CEO, and going into the schools and things like that. So there's many different programs that are happening, but just we need to scale them up, and they do different things, like my block, my hood, my city, exposing kids to downtown Chicago and things like that. There's a lot of different ways that people are trying to engage. And the other thing is internships, mentorships, jobs, so kids can build their resume. We just had a youth opportunity fair, and it was really to get young people off the streets, to show them what's out there for them, whether they're volunteering, it's an internship, or it's a paid job. That there are a lot of different opportunities. We just have to meet the young people where they are, especially. But also there's money for mental health also, because we hear that a lot, that there's a lot of great kids, but because of different things that have happened, COVID hasn't helped, that they're more on the edge, and they need someone that they can, counselor, therapist, school social worker, that they can talk to.
Right. They're easily triggered, no pun intended. And you're right. Trauma brings trauma, and hurt people hurt people. And a lot of these kids turn around that weight and never get a chance to express it or get help for it. And yeah, idleness leads to violence. When kids don't have stuff to do, they find other things to do that are not productive. I want to switch to Jada. Jada, you brought the fire. When I heard you at the conference, I got choked up. And even just now, again, I got choked up. And as I'm sure everybody who watched did. Again, I'm so sorry for what you went through. And I know there are a bunch of other youth out there like you. And I love the fact that you found your purpose and you made the most of it, and still making the most of it. One of my other mentees, Ginger Sanders, has a question, actually two questions as a medical student. Basically asks, how can medical students be involved in advocacy like what you did?
I feel like the first thing you should do is find something that you're passionate about. And I feel like after I found something that I was passionate about, which was gun violence, it just kind of, the whole world opened up for me. But I think the best thing is, sometimes we underestimate ourselves as medical students. Like, we can teach these stop the bleed courses, we can teach these standard CPR classes. And a lot of times we forget, a lot of communities don't really know how to do CPR. They don't know how to stop the bleed. And you can make such a large impact by going into like local community centers. I have done stop the bleeds in community buildings. I have done them outside on the street. Like, I have done them so many different places. And I just think it's really important to start teaching our youth kind of, and it's also like an exposure, like you're showing them the healthcare system, and you're also showing them a skill that may be able to save somebody's life. So that was how I kind of went to advocacy. And from these people that I meet at these programs, I was able to kind of network and get my name across DC. So
I think that would be the best start for somebody that is a medical student.
And that's an awesome answer because that's exactly what Dr. Pratt did with this Med CEEP program. He started teaching the programs and he found that those same youth saw that they could actually go into the medical field. So in doing so, you're also doing career goals and leading students to things that they would never thought about. So I love that fact. A second follow-up question she had was, what do you think is a major indicator in youth violence, and what actions can you suggest for youth to empower them to display more unity?
I think youth violence is really just truly bred out of poverty. And I think that kind of goes back to the social determinants of health that kind of influence health outcomes. I think of gun violence kind of as a pathology almost. And when people don't have like economic stability, they have food instability, they don't have access to education, and the healthcare system is failing. I don't really think that what else could we expect from these communities? So, in turn, I think it's really important for us to start going into these communities and addressing these different facets to kind of alleviate this youth violence. And I think representation is huge for them to see people that look like them to see us doing great things and ask them like what they need. Because it's really hard and it's very traumatic to lose so many people. These communities are losing hundreds of people in a summer, and a lot of these kids are going to so many funerals, and it's just so disheartening. And as somebody that has like experienced the loss of a loved one through gun violence, it takes a long time to heal. And I don't know like if I will ever truly fully heal, but to know that these children are experiencing all these violent acts at such a young age is just tremendously heartbreaking to me, and absolutely something needs to be done to help alleviate them and get them on the right path and get them to college or trade school or whatever they would like to pursue.
You know, I love what you said. Some of the things that I've seen in the past several years that I've been in this space, you have two cohorts of shooters. You have the at risk that you just said who are in those neighborhoods, and then you have everyone else. Because nowadays, you don't have to be from the hood or all these different marginalized places to get a gun and shoot somebody. And that's what we're seeing, that so many kids are mesmerized by guns. They see it everywhere on social media and in movies, and they just enthralled with the idea of having a gun. They're on social media taking pictures with guns, and then when they get into a situation, they don't use conflict resolution. And now if they have access, they now go and shoot somebody, and then they have regrets later. Because we deal with the kids who are high risk, who are in the juvenile court system, and a lot of them feel that they made these mistakes because they have so many access. And in Indiana, they're getting their guns from their 18 and 19-year-old cousins or brothers or friends. So it's really sad. I've had two 12-year-old students who took guns to school, and we've had kids 14 and 13 having two guns. So it just makes no sense. One other question that is a more global question, and I'm going to aim it to our Congresswoman. This is a question dealing with the relationship between. This is from Nikki Thran. She's an ER physician. Can you characterize the relationship between the firearm manufacturers and the drug cartels?
Really, that's an interesting question. And really, I can't, but I do know from staff research that over half the guns in Mexico come from the United States, because actually Mexico has strong gun violence prevention laws also. So they're getting over there somehow, and they are made by our manufacturers, but what the connection is and how they're getting there, I'm sure it's trafficking, just like we have in the United States, which the Bipartisan Safer Communities Act, that was my part of it, the store purchasing and the trafficking to really get a handle on that. But the same thing happens from the United States to Mexico. I can't say it's the, gun manufacturers giving them to the drug cartels, but they're getting there.
Wow, that's amazing. Somebody else, Dr. Renee F. Settle Robinson asked, can we get regular public service announcements to say, is your gun safely locked away? And I guess I'll ask that to Brenda. Can you answer that question? Take yourself off mute.
I certainly can. And I do want to mention ghost guns. They're untraceable. And that is real. The proliferation of that is really causing heart pains for law enforcement. But public service announcement, yes, that kind of goes back to what I was saying, having sponsorships from some of our partners. I'm actually working on one that I can't reveal right now, but we are working on something, and I think the more forums that we do and public service announcements, it would be great to hear from, even our doctors, our young students, rolling out something maybe all together. And I would be so excited, Dr. McGee and Jada and Congresswoman, for us to sit down and talk about what that would look like. So really, seriously, the more we talk, the more we get it out, and the more that they see different voices and faces, it's about awareness. So absolutely.
And can I just jump in that I'm sure I've done public service announcements because WVON, the Black radio station, allowed me to do it about the number of crib deaths. So I'm sure they will let us do it for this very important issue.
So we always talk about the social determinants of health, and that's on everybody's radar. But the thing that's most important, they don't even talk about how we can change the social determinants of health. And the only way you can change those social determinants of health is to know the political determinants of health, where you choose the right government to be in that place, somebody who's going to advocate for the policies that you want. And we can only do any of that by voting. So I think that should be our closing remark, that at the end of the day, all the things that we're seeing that's changing things now, we got to change it by voting the right people in place, even for women's rights and DEI and all these things that are now being changed. And, people are trying to take us back to the 1900s. We got to make those changes by voting the right people in. So I think we should go ahead and end there. We're 15 minutes over 8 o'clock. I definitely want to thank you guys. You've been wonderful. I think the messaging that we have got going, that we just released, was right on point. It's a good timing, and we need to have more of these. So you will hear back from us, and we love to have you guys on some more of our upcoming events that we're doing. So thank you guys so much. Clap it up for yourself, please. All right, we'll go ahead and end there. Thank you, world, for tuning in to us. We'll look back, and we'll hope to hear from you soon, and we'll go from there. Thank you, guys.